Good evening and welcome to Equine Field Service Google Hangout here at CSU. Tonight we're going to be discussing equine ophthalmology in the field. We have two presentations on common problems that we see in the field regarding the eyes, and we'll go over those. And then after that, we do have some questions that have been submitted by clients and friends of ours to answer as best we can. So just to start, my name is Luke Bass, and I am one of the faculty members here at CSU in the field service. My partner in crime is Dr. Elsbeth Swain. Dr. Swain, can you tell us just a little bit about yourself?
Thank you, Dr. Bass. It's great to be here tonight. So I am Dr. Swain. I'm also a faculty member with Equine Ambulatory Service, and I came from residency in internal medicine at UC Davis, and then have been with CSU for 2 years now. It's great to be here. Thank you so much.
So we will now begin with a couple of talks on equine ophthalmology and then answer some questions at the end. So for us to just go ahead and jump in this, we'll talk just a couple of minutes about the horse eye and then go into corneal ulcers. So the equine eye is actually the largest of any land mammal. It magnifies everything 50% larger than we perceive it. The horses have a monocular vision, so they see one side with the left eye and one side with the right eye. They have a very distinctive blind spot in the front part, and that's right in front of the nose and right behind the tail. So two spots to be the most careful around with the horse. They actually do have better vision versus humans at night. They are a prey animal, so they need to be able to basically move much faster than we do at night. And more importantly, they perceive color differently. Their vision diminishes at night, but they can see really well with green, yellow, and blue. However, red colors are hard to differentiate in the horse. So jumping right into the front part of the eye, or the cornea, which is one of the areas of the eye that we're most concerned about as veterinarians. What is there to kind of protect the eye from the outside world? Well, you see that there are lids, the top and the bottom eyelids, and there's also a third eyelid that is there for protection. But more importantly is the defense mechanisms of the cornea. You can see that the cornea and the eyelids basically are there to help wash the tear film and to help blink. There's also antimicrobial substances in the tears that really help protect the eye on a day-to-day basis. So when we talk about corneal ulcers, and these are probably 70 to 80% of the cases that we encounter as field practitioners, what happens is there's a defect in that corneal epithelium, or basically the outer layer. This can reach down to the deeper layers, but basically what's happening is the defense mechanisms that you have and the normal functions of the cornea are compromised. And so you can see how that is a problem for the horse. And it's a big problem due to the prominence of the horse eye and really the large size of the cornea. The horse eyes are basically sitting on each side of the head, and they're waiting for something to poke them or go wrong. These corneal ulcerations can be sight and eye threatening. So one of the more important things that we stress to owners is early diagnosis and treatment is really the most critical part for positive outcome. Unfortunately, superficial erosions or abrasions can quickly progress to severe ulcers in a short period of time. So our goal is to basically treat all the ulcers very, very aggressively and monitor for healing. And so to basically get your horse back going as soon as possible. But here's some pictures of some corneal ulcers that I have seen in the past, and you can see these things range from anywhere on the bottom photo with some fluorescein stain is a very superficial corneal ulcer, all the way into the top two that are much deeper and much more severe. So what are some clinical signs of corneal ulcers? Probably the two most important signs that I want to portray, or I want to make sure you understand, is the pain of the eye with squinting and tearing. You can also have sensitivity to light and some discharge from the eye. But the most important things you're going to be looking for is squinting and tearing. You can see on the picture on the bottom right that the horse looks like it has pus coming from the eye, but that's actually just a lot of goop and a lot of eye boogers that signify there's a problem. And you can see on the picture on the left, there's some swelling of the right eye. that really just tells us that there's a problem there. So sometimes we get calls to say, you know, come see my horse, he has a blue eye. That's actually corneal edema. And with the cornea being a clear surface, you actually get edema or swelling like you would for any other wound, but it just shows up as being that blue tinge because it's a clear surface. Horses that have swollen eyelids, horses that have conjunctivitis, which you can see on the bottom right photo with the reddened conjunctiva, all these can be signs of eye pain or eye problems, which is something that we need to see as soon as possible. Another clinical sign that you can see, and it really gives you an indication of maybe how long things have been going on, is a big long word named neovascularization. And all that means is there's blood vessels migrating from the periphery of the cornea to aid in the healing. And you can see in this picture the red blood vessels that are coming from the top down onto the cornea. This process takes about 5 to 7 days to start and happen. And so a lot of times once you see this, the cornea is actually already healed itself. But these are definitely signs to pay attention to with a horse that has an eye injury. So when we come out and look at these things, we're going to do a very thorough physical exam and ophthalmology exam as well. But how we diagnose corneal ulcers is the photo in the top right, which is called a fluorescein stain. We put this stain in the eye, and if there is trauma to the surface of the eye, it will stain green. So that allows us to know that there's been a problem and there's a defect in the cornea. You can see a difference in the photo on the left. There's some edema with the neovascularization, but the picture on the right is a very superficial abrasion with a nice clear cornea, and you can see that the iris is brown behind it with the pupil and the lens just between that. So these are tools that you're going to see veterinarians use to diagnose the corneal ulcers. And really give us an idea of how severe the case may be. So what does our treatment consist of? This begins the hard part for you because it's most of the time very intensive and very aggressive, but our goal is to get the horse feeling as best as possible as quickly for you. So we're going to most likely put in antibiotics. Now this is not to really primarily treat the problem, but it's more of preventing an infection. While the horse's cornea is able to heal. There's a drug called atropine, and you can see a distinct difference in the size of the pupil on the left versus the right. So atropine is used if necessary to help dilate the pupil, and that will help decrease the severity of the pain in the eye. One cool thing that we can really use for horses is what's called serum. And so we're able to take the horse's blood and separate the serum away from the red cells, and that contains a lot of healing factors. And so we basically apply that directly to the cornea, and that can really help in an organic fashion, really help the eye to make it heal somewhat faster. And last but probably the most important is Banamine. We like to use non-steroidals, systemic medications for eye pain. There's been a lot of research into what medications are the best, and multiple studies have shown that Banamine is the way to go for managing eye pain. And just lastly, just some ancillary therapies that we have used to great success that I just wanted to mention. One is soft contact lenses. You can actually put a contact lens in a horse's eye and help protect it from the outside environment when there's a corneal ulcer. There are some precautions with this, so it's always nice to have your veterinarian managing these cases. There's some fancy words here: debridement, burring, grid keratotomy. These are things that we can use to basically stimulate the cornea to heal faster. Conjunctival flaps for those cases that are very resistant to our therapies. The word temporary tarsorrhaphy means closing the eyes with suture for a temporary amount of time to allow the eye to heal much faster. You can see a picture on the very top. Seems like there's a tube running in on top of the eye. That's called an SPL, or subpalpebral lavage system. That allows us to put medication directly into the eye through a syringe and a needle with a port, as a lot of these horses can get really refractory to medications. So it makes it way easier for you and way more successful for your horse. And then the picture on the bottom is a picture of an eye saver. And these horses, just like us with wounds, can get quite itchy. And so it's nice to put a a convex shaped bulb over the eye, so they really can't itch it and make it worse. But these are things that really help corneas heal and really help your horse get back to action as fast as possible. The last slide we'll talk about is corneal healing and what to expect once you have one of these problems. Usually healings of a large diameter, superficial, non-infected ulcer may take 5 to 7 days, and then it slows down to some extent. Ulcers in the second eye heal slower than the first. We have increased tear enzyme activity. And then recheck appointments are very important to monitor healing. There's a lot of investment you're making with your horse in fixing these corneal ulcers, but recheck exams are quite important to make sure that everything is on the up and up. So that concludes the part on corneal ulcers. I'm going to turn it over to Dr. Swain, and she's going to talk a little bit about equine recurrent uveitis, and then we'll take it from there. Dr. Swain?
Thank you, Dr. Bass. Okay, I'll get us set up. Okay, so we're going to switch gears from the cornea and go a little bit deeper into the eye and talk about a condition called equine uveitis. So to start with, we'll start with just a little bit of anatomy and what the uveal tract actually is. So this is the outlined in red. All of the sections on this slide outlined in red are part of the uveal tract, and it contains most of the blood supply to the eye. What it is it provides a normal barrier between the eye and then the tract and then the rest of the body's circulation. So it really protects the eye from inflammatory cells and antibodies themselves, which all can be very damaging to the inside of the eye. So when it becomes damaged, which it can become damaged by many things, it causes inflammation and is called uveitis. And when this barrier is disrupted, all the blood products and cells that normally live in circulation and are separate from the eye itself can enter into the eye and basically cause trauma. The antibodies and inflammatory factors react within the normal tissue of the eye, and it results in injury of the structures of the eye. And that's what's shown in this picture here. There are blood vessels surrounding the entire eye, and then also a very hazy appearance beyond the cornea. So what can cause this is many things. Some are non-infectious and often traumatic. So sometimes even just getting a blunt injury to the globe by hitting the horse, hitting its head on something, or actually sustaining trauma to the cornea itself. And in cases of corneal ulceration, that can even trigger this inflammatory response within the eye. There are also infectious causes, and one of the most problematic bacteria that causes this is called Leptospira. That's shown in the picture here. And this is something that, if your horse is diagnosed with uveitis, to have your vet or discuss with your vet and talk about this as an option. Other things that can cause this are systemic sepsis, and this means just a widespread infection throughout the horse's body that can also affect the eye. And this is most common in babies, especially the neonatal period. And so the eye can sometimes just be another site for inflammation to occur. And then other things that can cause this are viral or parasitic causes. And then there is a genetic component as well that's less understood, but quite frequently they've been able to identify a few genetic factors to predispose horses to this. One thing that is very frustrating for veterinarians and horse owners is a condition where this uveitis recurs, and it's called equine recurrent uveitis, or the more common name for it is moon blindness. And it is caused by a cyclic inflammation within one of the chambers of the eye. And this picture shows a very hazy appearance to the eye. You can still see inside of it, but there's just all of those inflammatory factors floating inside and causing a flare inside the eye. And then this arrow shows a white line, which is just an accumulation of cells below that, and that's all white blood cells from the bloodstream that shouldn't be in the eye. So equine recurrent uveitis is actually the leading cause of blindness in horses. And it's defined as recurrent when a horse experiences 2 or more episodes in less than 2 years' time. And then sometimes these episodes can be very frequent and progressive over time. The classic episodes cause inflammation and pain in the eye, and then the horse remains comfortable for certain periods of time between episodes. And this condition can affect either one or both eyes. There are lots of causes and lots of classifications of this condition. So it's very complex and very individual to each horse. Every horse appears different and their progression is very different. And the length of episodes or frequency of episodes is very different. So all breeds can be affected by this condition, and I've seen many, many breeds affected, but Appaloosas do have much higher odds for developing this condition than any other breed. ERU is just the shorter name for equine recurrent uveitis. And the Appaloosas have a little bit different progression of this, and it's very insidious, which just means that it can often be more of a smoldering progression rather than dramatic flares, especially compared to other breeds. Many Appaloosas are unfortunately affected bilaterally. This is something that commonly affects them, and then commonly affects them worse by affecting both eyes. They also have more severe progression if they're also positive for an infection with that leptospira bacteria that I was talking about earlier too, that's associated with this condition. Some of the signs, especially in the acute phase of a flare, is associated similar to the corneal ulcers. So they have pain and excessive tearing. And this horse is also showing some light sensitivity. So they'll squint frequently when exposed to light, or just keep their eye slammed shut to protect them from the light and to show you that they're painful. Then the cornea color is the color actually to the whole eye is very important in these cases. So that blue color is that corneal edema that Dr. Bass was talking about, and sometimes it's caused by corneal ulcers, and then sometimes it's just caused by the inflammation within the eye. And then there's also cases that have a green hue to the eye, like this picture on the right. And this is all the inflammatory cells and factors that are floating inside the globe and then create a green hue to it. One of the signs of uveitis is also a small pupil size. So this picture on the left is a nice small pupil, but this can happen occasionally where the pain is great, and so the inflammation and pain of that eye trigger the pupil to really constrict. And then that's it won't respond to light or lack of light and dilate like normal. Then in chronic cases of uveitis, where they have repeated flares, this causes progressive changes within the eye, and each flare can cause more and more problems. And so one of the things we see are the corpora nigra, which are the fluffy appearance to the top of the pupil, is shown on the left picture. And then this over time can recess and almost go away in some of these cases if they have enough flares and it's a chronic enough progression. And so this picture on the right has shown that those are very blunted in appearance. Other things that can happen are this picture showing scarring of the iris, where it becomes leaky and sticky, and so it starts sticking to the cornea or to the lens. And this picture showing the iris that's sticking to the actual lens. And this can change the shape of the iris and then also restrict the iris's ability to open and close, and so may affect your horse's pupil size. Another common condition that can develop is cataract formation. And so this horse has a very opaque lens inside of its pupil, and the pupil size is also very abnormally shaped. And so it has a combination of a complete cataract and then also the iris scarring as well. Many secondary conditions can develop because of uveitis. The chronic inflammation every episode can lead to more and more problems. And so one of the things that can happen is that because of the inflammation, it can cause poor corneal health. And then this can actually lead to repeated corneal ulcers, which can be very frustrating because it can delay the treatment of the uveitis and complicate the whole picture for that horse. Another condition that can occur secondary to uveitis is glaucoma. This is a condition where the pressures of the eye go very high and can affect the horse's vision because of trauma because of those pressures. And then, like we talked about earlier, blindness is extremely common as a eventual sequela of this condition. So diagnosing this condition is the ophthalmic exam by your veterinarian is absolutely key. There are very consistent ocular changes that we look for, and then we can also measure the pressures within the eye, and that helps us stage this condition if they're low versus if they're high, and help with prognosis. Other things that we can do are blood work. Sometimes we're able to identify other health conditions that may be contributing to the horse being predisposed to uveitis. And then also we can test for antibody levels of that bacteria, the Leptospira, and sometimes we're able to detect that is a component of this condition, although it can be tricky to do that in some cases. Other things that we can do are actually testing the intraocular fluid for some of these pathogens and bacteria. And we also can look at the cytology, which is just looking at the cells within the eye and looking at the differences and seeing what the trigger may be. Treatment, the major goals are to preserve the vision and decrease pain, and then also to minimize and prevent recurrence as much as we're able to. And catching this early is definitely important for this disease progression. We use a lot of topical ointments for this condition, and many of the protocols for treatment involve steroids, although this can be very problematic because if you apply a steroid to a cornea that has an ulcer on it, then you can cause many more problems. So if your vet is going to treat with a steroid, then we always try to stain the cornea first. And then we also focus on trying to dilate the pupil so that if the iris should scar in this condition, that the pupil is dilated and there's less pain and then less amount of scarring. And then we also try, if there are corneal diseases that are secondary to this condition, then we try to treat those too. Other systemic medications are Banamine, like Dr. Bass talked about earlier, to help control the inflammation systemically and also within the eye, and then help with pain. And then also sometimes we'll use antibiotics for this as well. The complications to treatment is that over time and with repeated episodes, this can be very frustrating and expensive. And then the horse may become intolerant after a while for medication application. And then also the horse's organs can also be injured from chronic use of these medications. And so they're all things that we take into account and treat the whole horse and try to help support clients and the horses as much as we can. Other possibilities for treatment is a long-acting immune modulating agent called cyclosporin. And so it's called a suprachoroidal implant, and it's applied to the eye surgically and can slowly release this immune modulating drug for over 2 to 5 years, which really helps decrease the the frequency of these episodes. And so this is something that if your horse is affected by uveitis, that you would discuss with your veterinarian first, and then certainly with an ophthalmologist to make sure that your horse is the right candidate. Ideal candidates have controlled episodes, and they do respond to medications. The ones that are refractory to medications and have persistent episodes are not good candidates for this treatment. The prognosis for vision for equine recurrent uveitis is always guarded. This is because every time the eye has a flare, it becomes more and more injured. And so even despite all of the best care and the best efforts on everybody's part, the horse may lose vision over time. And then about 25% of these horses do experience corneal ulceration just because the inflammation can traumatize that cornea. And so this also can limit your control of the uveitis when the horse has an ulcer. And then, as with everything, early diagnosis and control is key, although these can be very, very frustrating cases. Okay, we're going to turn over to Dr. Bass. Again, he's got some questions, and you guys can also submit questions at any time by emailing the CVMBS social media at coloradostate.edu or using hashtag paging Dr. Ram on social media.
Awesome. Thank you so much, Dr. Swain. So we do have some questions that some of our great clients have submitted. And the first one comes from Kimberly from Denver, Colorado. She wants to know if she should purchase a horse with blue eyes. Are there going to be any vision problems associated with blue eyes? And I can answer that one. I've had several friends ask me the same question before. So it's often a bit daunting when you look in the horses and they may have 1 to 2 blue eyes. There's actually no medical problems associated with the different color of the eye. You know, if you have different colors of the iris or different colors of different parts of the eye potentially, but most of the time the blue eye is just a different color. There's really no medical problems that the horse should encounter over time. Second question I'll give to Dr. Swain. This one is from Sharon. She wants to know, can cataract surgery be performed on horses? Dr. Swain, do you have an answer for that?
I do, thank you. The great question. So cataract surgery can be performed in horses. There are many things that go into the decision-making factor, and the ophthalmology service is always involved in those decision-making plans for the horse. But as long as the horse is visual and its retina, which lives at the back of the eye, is healthy, and there is a good prognosis for vision, then some of these cases can have successful vision after receiving cataract surgery, which is exciting.
Cool, thank you. So another question comes from Hallie, and Hallie lives in Omaha, Nebraska. So something I didn't mention during the corneal ulcers, so I can answer this one for her, is what can I do to help prevent different eye conditions like corneal ulcers? And that's a great question, because we're always happy to help clients prevent diseases versus having to spend money on treating them. I think one of the biggest things is just protection. A lot of times in the summertime, flies can be quite irritating to the eyes. So the use of a fly mask can be really, really helpful. Fly spray is another thing that can really deter flies away in the summertime. I think in the fall and winter time, when we don't have so much flies around, it's just being cognizant of what's going on with your horse's eye, making sure there's no sharp objects in the stalls or the paddocks, and just being cognizant of what eye pain looks like. I think those are the biggest things to check for. And then just making sure your veterinarian looks at your horse once or twice a year for physical exams during vaccines or teeth floating. Just have your veterinarian check, take a look at the eyes and make sure there's no, kind of degenerative changes that are going on, or anything that may make the horse more prone to getting the eye ulcers. Next question, we'll give this to Dr. Swain. Robert and Pat want to know, are there any behavioral signs I would notice if my horse was having an eye problem?
That's another good question. We see quite a few horses that as their vision starts to become affected by various reasons, that they'll start spooking abnormally, or they may develop a head tilt, or other kind of triggers that you may pick up on that aren't normal for your horse, that may definitely recommend you chatting with your vet about it, and then having the eye looked at, or both eyes looked at, just to see what's going on and see if there's anything that can be detected as far as a change within the eye to explain the behavior change.
Awesome, thank you. So we have time for one more question, and it really involves a case that Dr. Swain was just talking about, the condition with equine recurrent uveitis. My friend, this is Debbie from Littleton, Colorado, wants to know, she has a friend who has a blind Appaloosa horse that suffers from equine recurrent uveitis, that she would like to basically give to Debbie. He's a wonderful old horse, and I want to just give him a good home. Do you have any suggestions for caring for a blind horse? Dr. Swain, do you want to elaborate on how to care for a blind horse, especially one that's suffering from equine recurrent uveitis?
Absolutely. That can be a challenge, but also I've seen a lot of horses that are blind that lead very happy lives for many, many, many years. And so some of the things that we can do, especially if the horse is going to be moving somewhere new, is trying to keep as many things the same as possible. And so if they have a friend that they always live with, then keeping the friend consistent over time, keeping the paddock is consistent over time, so they get to learn their environment, and then doing lots to talk to the horse as you approach the horse. Just they have so much hyper sensitivity over all of their senses to help them compensate for being not having their vision. And so just using all those other things, allowing them to smell your hands before you touch them, and other things that you can do to help work around these horses. But these horses oftentimes lead very comfortable lives and start trusting the other horse and using cues from the other horse that they're stabled with to help with everything in their environment, and makes them quite happy. And I've seen many horses that have had eyes enucleated or removed because of pain that cannot be controlled, and they've done really well. And sometimes they're even happier after the procedure is done or performed, just because their pain is now gone, which actually just makes me very, very happy that we've been able to do that for those horses. And then especially with a Appaloosa that has concerns of the vision going in the other eye, then just starting everything to be consistent as possible and help support them in their progressive disease. Thanks
so much. That was some really good practical information, I think, for people who have some concerns. At this point, we're basically going to wrap it up. We want to thank everyone for joining us tonight. We want to thank you for sticking with us through our technical difficulties. We appreciate that. If you have any other questions, please just submit them by email. We have an amazing communications team here at CSU that can get those to us, and we can get those questions answered as best as possible. If you would like to watch this hangout again, or maybe want to see another one of our hangouts on colic or metabolic disease, just please feel free to visit our YouTube page. That's the CSU College of Veterinary Medicine and Biomedical Sciences YouTube page, and you can see all of those Google Hangouts there. But again, thanks so much, Dr. Swain, for giving some time tonight, and thanks to all of you for watching, and we'll catch you next time.